The inmate population is down and so is crime. The other unknown is what we had to get ready for in 05 and 06 and 07, and what we got ready for was, I was told by projections made from the professionals that we would be in 2010, our population would be 1,203. This is 2012, and my population this morning is 670. What did we do in 05, 06, and 07 was we added to the Phase 2 facility, which is at the Fred Allenbrand Criminal Justice Complex in Gardner, Kansas. I added what was scheduled to be 200 beds. I convinced the Board of County Commissioners, instead of just building vacant concrete, let's go ahead and build out for the future, so we're not talking about building more jails. And we stuck with the modular system that we're currently using, but we just expanded the population of those modules. We went from 20-person modules to 60-person modules. That's going to pay off now while we're in this downward trend. Johnson County still is on a very good pace for growth. You know, their projections are 10 to 13,000 per year with no slowdown until 2022. Whether we'll still be on that track for those beds, I guess I'll be like the professional consultants. Sometimes it's like me asking you for your watch so I can tell you what time it is. And so you kind of play that game a little bit, but what we did with the downtown jail, we were kind of changing how we're doing business. And by that, I mean we're going to start handling inmates in a different manner. And we've got some different initiatives in place that I think are very innovative as far as keeping these jail populations down if we can. Now, don't get me wrong, when I start talking about some of these programs, we're not soft on crime. That has not changed. About 17 to 19% of our populations are classified as mentally ill. In other words, they're diagnosed with a mental illness, which requires intervention, which requires medical treatment and psychological treatment while they're incarcerated. So what we've done with this program is we've established this FACT team inside our jails. Instead of waiting for them to be released, reoffend, and then trying to do some intervention, we're starting at sentencing. And so the Phase 1 of the program is they serve anywhere from 30 days, depending on their sentence. We won't usually take them into the program unless they've got a year to do, because it takes that much time to make the program function. So the first 30 to 90 days, while we're working with them in the adult detention facilities, we're now beginning to identify what we call their criminogenic needs. We're working on substance abuse, we're working on anger management, we're working on their behaviors that continually attract those of us in my business that stand behind the badge. In Phase 2, up to the next 90 to 120 days, they'll be put in a work release center, which is just adjacent to our facility there at the Century. What we're hoping to do there at that work release center is, again, get them directly involved in the programs that I just mentioned, depending on their criminogenic needs. They then are put into the community. We're finding them jobs, we're helping them find the jobs, but they have an obligation to have a job within 30 days or they go back to the facility. It costs on average, depending on the classification of the inmate, but overall, I'm going to just give you an average, it costs $104 a day per inmate, per day. So you can see how quickly this will add up as far as cost to us, to you and I, as citizens in this county. So when they make it to Phase 3, that's 90 to 120 days in the community. That is when they're employed, they're completing their program management, whatever that might be, and they're also have full-time jobs, or at least we're trying to get them to that point. And probably the most important thing is that most of them at this point are drug-free, alcohol-free. They're not reoffending. Now, does it stop there? And the answer is, of course, no. What we don't do in this program, I will not accept sexual predators, and we will not accept hardcore felons. We did a collaborative and cooperative project with the City of Olathe. We have the Mental Health Intercept project that has been very successful. In the last year, we're utilizing a crisis response trained group of officers that include Olathe, the county, and there's a lot of municipalities involved in this as well. This team in Olathe has had 92 contacts with the mentally ill, and only 3 of those resulted in incarceration. So we managed to get some intervention there and some services there without going to jail. Now, does that mean that every mentally ill person does not belong in jail? And the answer to that's no. There are some that are mentally ill, that the types of crime they commit, jail is society's solution. The bottom line is we're holding more and more of these type of offenders in our system, which I think there's some other intervention, there's some other innovative ways of handling these without just putting them and parking them in county jails. I'm going to hit real quick on illegal immigrants in our jails. You know, I don't know what numbers you might have in mind as who's in our jails, but in 2011, for the entire year of 2011, we incarcerated 392 that were classified by ICE as illegally in the country. 278 were from Mexico, 36 from Honduras, 26 from Guatemala, 14 from Kenya, 9 from El Salvador. We've had some from Russia, a few from Germany, and we've had a couple from Canada. So far this year, we've had 38 from Mexico, 4 from Honduras, 3 from Guatemala, 2 from El Salvador, and 5 from all others, bringing a total of 52 so far this year. Now, here's some interesting things. In 2011, 95 of the total were charged with felonies, 95. Misdemeanors 113, and municipal charges were 170. And then some civil issues that would be like divorce or domestic violence. What I find interesting, though, is the ICE holds. In other words, that immigration has got a hold on them, saying when you're done with them, county and state, we're going to deport. The numbers in 2011 were 11. Incarcerated 392 had 11 holds. In 2012, out of the 52 so far, ICE holds have 2. So I have 50 that when their state charges or municipal charges are done, they will be released back into society.